and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary Leblanc. On this episode of the podcast, I am joined by Dr. Kirk Anthony Stewart, the Executive Lead for Black Health Programs, and Alfred, the Associate Vice President for Integrated Care and Experience at Durham Community Health Centre. This is a community health centre that is across Durham region in Ontario. Durham Community Health Centre has been doing integral work for the Black community, and we wanted to highlight this for Black History Month, which I am biased, it is one of my favorite months. How are you both doing today?
Doing well today.
Good. Alfred, you're well as well? Yeah, awesome. So Alfred, I'm going to start with you. If you could tell us a bit about Durham Community Health Centre, the community that you serve, some of the key services and programs that you provide.
Absolutely. Thanks, Hilary. And thanks for having us on the podcast. So Durham Community Health Centre, or DCHC, as we like to call it, is a vital part of the healthcare landscape in the Durham region. We have been in existence and in expansion for the greater part of over 2 decades now. We're a community-based nonprofit organization dedicated to improving health and well-being of individuals and families, especially those that face barriers to access and care. We have a very strong emphasis, much like many CHCs, on health equity, inclusivity, and culturally responsive care, and trying to ensure that everyone in the community receives the support they need, regardless of their background, income, or life circumstances. You mentioned Durham region. We serve a very diverse and growing population across Durham region. We have 3 physical sites in Oshawa, North South, and Pickering. But with some of the new funding and services in mobile service and virtual care, our breadth is really across Durham and really in many respects Ontario East itself. So clients include seniors, newcomers, racialized communities, people experiencing homelessness, youth and individuals living with chronic health disease or conditions, and mental health challenges. And you made mention of our focus on the ACB Black community. And this is definitely a growing emphasis for the organization, where we want to take a really holistic approach to health that includes both medical care and community and social supports. And those kinds of services range, from at DCHC, diabetes education, mental health, food security programs, and then most recently, we are the beneficiary of 2 new and exciting investments from the province, where we get to further partnerships with our widespread community collaborations in a youth wellness hub, and then also in a new heart hub for addictions and mental health and for individuals who are experiencing homelessness.
That's amazing. So exciting. Thank you so much. I've been thrilled to know Durham CHC for a while, like I mentioned before we started. I've spoken with Francis before, and so it's always nice to hear about everything you've got going on. Just further, I guess, east of me, which not too far to be fair from where I am, but I'm always happy to hear what you've got going on. And I'm curious about, I saw a Black Health report, an infographic that was done alongside other members of our organization, like Black Creek Community Health Centre, Flemington Health Centre, Rexdale, Wellfort Community Health Services. And I was curious what led to the creation of this report, an infographic, and a bit of the impetus for it.
Mm-hmm. Yeah. Well, you make mention of Francis. So Francis Garway is our CEO, and he's been one of many individuals leading the charge in providing a voice to supporting Black health and wellness needs. The report you make mention of, I think, like all significant milestones, it's really part of a much larger story. And this story is expansive across the whole country, but really this unfortunate reality of systemic inequalities that have existed for many in our communities much longer than we wish to acknowledge. So this has kind of contributed to significant inequities for health challenges for African, Caribbean, Black ACB communities across Ontario. And this work really began in earnest after the COVID-19 pandemic. when challenges in these communities and others were really made evident, and the Ontario government was responsive in launching what was termed the High Priorities Community Strategy. This, alongside the Ontario Black Health Plan, which was issued in 2023, really for the trigger or the impetus to continued work and emphasis and further investment across our system. So the Black Health Report is really born from this work, where some of those CHCs that you make mention of, Black Creek, Flemington, Rexdale, and Wellfort, they contributed to a larger effort in reflecting upon the work that was initiated and built in those early days post-COVID, so that we can really take a step back, share learnings, and potential future opportunities across the provincial landscape. For DCHC, through our work on the ground, we really saw firsthand how structural racism, social determinants of health, and a lack of cultural responsive care were impacting Black individuals and families. And I think while this knowledge has been present, and we've spoken of an interest and need to address this, I think for DCHC, really in the last year plus, with the arrival of Kirk and members of his growing team, we're really starting to chip away at the work that's necessary in our Durham region. So this is just the beginning. We really need a lot of continued and sustained collective effort and action from ourselves, community partners, and other healthcare leaders. So really excited to be able to share with you some of the work that's been underway, that Kirk has been spearheading, and what we think of for the future.
Awesome. Thank you. And I think either of you can answer this question in terms of what impact you hope that the report will have, and what are some key takeaways that you want people to walk away with, especially like I did get to see, the infographic and see some of what's being shared. So I'm curious what you hope when people look at it, what you hope they will take away from it.
Well, I can start. I mean, I think we learn from not only experiences, but most crucially from reflection, right, and conversation. And that conversation, the reflection as to where we are as a system, as a society, it isn't a one-time occurrence. And it's crucial that we continue to take stock as to where we are and what needs to happen. So I think the report itself is one step towards that ongoing, broader, deeper discussion. And I think it's especially important with the kinds of things, and be remiss not to make mention of that are happening with our neighbors down south, where voices are and stories and reflection is being disrespected. It's being hampered and locked down, and we won't permit that. That's one step within this report, and there are many more that we have to share and to celebrate, this month, the month upcoming, and beyond that. So it's crucial that we continue the conversation.
Thank you. Kirk, did you want to add anything to that in regards to what you hope the impact of the report will be?
Yeah, so um well, I wasn't around for COVID. I was in the States. I was actually working in Illinois. I worked at a few trauma centers. I worked in the community. And so what in coming back and reading the report and kind of understand where it came from and how it was written and why it was written, um, it was almost like I traveled to a different country, but a different space in time around one collective experience, but from another angle. And so hearing some of the messages that, went into putting that report together and seeing what I experienced in the States, for me, I'm highlighting, or in my mind, I have highlighted opportunities that I think we could explore with DCHC. I also like reports in that they timestamp where were at that time. And my hope is that we'll use that as a reference to see what we need to do moving forward. If you talk to any of the people that work with me or that I work for, I don't like to talk a lot. I like to do. So, for me, reports, it's important to have, but I'm more interested in how we're going to translate that into action. And I think that's where we are right now with DCHC.
That's awesome. And in terms of actionable items and work that you're doing, Durham CHC is hosting a Black Health and Wellness Day, which is the first of its kind for the Durham region on March 1st. Yes, that background of Kirk is the flyer. So why was it important to host this, and why is it important to highlight Black health and wellness? Especially, my favorite thing is the day after the end of Black History Month, because I felt like that was very purposeful. I would assume so. So I'm very curious to learn more about this.
I mean, it's a long story, to be honest. It wasn't something that I sat there and put together over a couple of days. What happened was DCHC, we've had symposiums before, Black Health symposiums. And again, I wasn't here for those. But in looking at the reports and some of the pictures and some of the data collected from that space, I felt like it was more um, attractive for members of the community that are in the field of healthcare and, providing care for community members, which, we need that. We need to have those spaces where we discuss items that we feel as professionals need to be highlighted and how we're going to work around those things. But when I took this task on as the lead for the Black Health and Wellness team for DCHC, I wanted something different. I felt in Durham, I lived here since 2008. And back in those days, things looked a lot different when you go to Walmart or go to the grocery store, Starbucks, what have you, in terms of the type of people you're seeing. Um, and so for me, I don't know if I could say at that time confidently DCHC had a good pulse on what's happening in the Black community. And so I decided to sit back a little bit and think about, okay, maybe we should involve the entire community. Those providers are already on the ground doing the work with the community in a very intimate way and get them to kind of help us understand where we are. And so from that, we still do have a strong relationship with Durham Children's Aid Society. And one of the staff members there, I don't think she's there anymore. I spent a lot of time working with her, and with other cases. And one day I was like, maybe what would happen if we invited everybody to this event that we're coming? Would you be interested? She said, absolutely. I think our department would be interested. And then we talked some more about what it would look like. And then from there, she mentioned there's a group, around 30 or so providers that are in this space in the community that might be interested. And so we actually had a meeting, invited them in. And long story short, those 30 providers were invested in our vision of having a day proclaimed in Durham as a Black Health and Wellness Day. It's not been done across Ontario. I didn't spend time looking how far it goes. I don't think there's any other place in Canada right now that's highlighting a day specifically for Black health and wellness. Answer the other question you asked about why Black health and wellness. Well, I think for years, and if you're in the funding space for social services and whatnot, mental health was always funded. We know mental health, trauma, the keywords that you use to talk about mental health for Black people was always there. What was challenging for me as a provider or as a physician was, okay, you still have to check your blood pressure. You still have to get your glucose managed. And then what really drove that home for me while I was in the States was people weren't dying because of mental health. When COVID came around, the studies that we were looking at weren't, okay, they have generalized anxiety, now it's exacerbated, now they're coming into the ER, and no, it was literally those unattended hypertensive cases where they couldn't have access to their primary care provider, or poorly managed diabetes. Those were the things that were highlighted. And that's why people are coming in, and the exacerbation of pneumonia and whatnot due to COVID. And so from that, it opened my eyes to realize that we need to not necessarily see mental health as a separate pocket from physical health. It's all one and the same. Any provider you talk to, they don't separate it out. So I wanted it to be clear from the health perspective. We understand health, mental health, physical health, spiritual health is all a part of it. Wellness now speaks to the community because that's a bigger picture. We talk about social determinants of health. That's one thing, but even being in a space of Black people and feeling comfortable, feeling safe. You could say things and not have to think, translate it 5 million times in your mind before you say it. That's the wellness that we're trying to achieve here. We also want to highlight that Western medicine, what we know in Canada, even in North America, that's not the only way we could do things. That's not the only lens that we have. We have people from different parts of the world that make up the Black people in Durham. And so we wanted to highlight those experiences and give a platform where they come to the table. One of the things that we're saying now is that, and I'm pushing this really hard. For years, I feel the Black community has waited for a solution, waited for somebody to respond. And for the Black Health and Wellness Day, we're pushing the idea that I wonder if we're the solution, for a lot of the health woes that we have in Ontario, especially for some of the issues that's been there for Black people for a while. So that's the premise behind the Black Health and Wellness Day is to really encourage Black people in Durham region to now stand up and have some say in how their health looks and be a part of the solution itself. March 1st. Now no, it wasn't initially designed to, it was designed actually to be February 1st, to start Black History Month with health being the focus. But we spent a lot of time with the 30 community partners and they highlighted for us, how important it is to have solidarity in terms of how we move forward. A lot of the organizations that we work with, including Durham Region itself, already had a calendar of events. And so instead of taking away attention from what already exists, we decided, okay, we'll actually put forward some of the activities or most of the activities in the community on our platform of marketing and advertisements and whatnot. And we'll step back in the background and support, and then use March 1st to have that space. Nowhere in the region, I think there's one other event going on, but we just found out about that way after we started planning. But we figured March 1st would be the next best date to really drive this thing home and in the minds of the people in the community.
Yeah, I think March 1st is great because there's just so many times I think as Black people, we have to advocate for the fact that like Black people exist outside of February. And so I think it's great to have things spill over into the next month personally to remind people Black people are still Black in March. There's a recent
Yeah.
summer where somebody said, well, I'm still Black in September. And I was like,
Yeah. Yeah.
we are. So I do appreciate that. It sounds like an awesome event. I'm curious what people can expect. You've mentioned some of the partners and some, the highlight of health and wellness. So for people who want to attend, what can they expect to experience? And what do you think their main takeaways will be if they happen to roll through?
Yeah, for sure. So the main part of the day will be between 10 and 11. We'll have the proclamation ceremony. I didn't know there was a formal ceremony involved with it. I thought, the chair was just going to sign a piece of paper and give it to us and say, have a good day. But there's apparently a whole ceremony behind it. So we'll have the chair for, or I think it's the president, whatever the term they use for for Durham Region to come down and make it a formal exchange. So we really want people to come out and witness that because we want to burn in the back of our minds moving forward till the end of time that that day was designated for, or March 1st is designated for that. And then throughout the day, other highlights we have for the health side of things, we'll be doing screening for sickle cell disease, hypertension, type 2 diabetes. We'll be providing education and potentially screening for prostate cancer using PSA levels. We'll also be doing a lactation consultant space where young moms or moms in general could come in and learn about the importance of breastfeeding and how to go about doing it effectively. And we'll also be doing hearing exams, so people could come in and have their hearing and also their ears checked. And then from their wellness, we have two types of yoga going on. We have drumming circles, we have libations going on, we have some poetry, we have some singing, we have some stand-up comedy going on, and then we have a vendor section. So we wanted to highlight in the community that there are people that are out there that provide services where in the space of Black health and wellness. And so we have right now it's around 60 vendors that's going to be at this site that's going to provide some services to the community. And then we'll have a panel. The panel should be also a focal point between 10 and 11. We're just scratching the surface with answering some questions around what does Black health look like in Durham region versus everywhere else in, the world. And I think that's important for us because a lot of us have been transplanted for whatever reason to Durham. We had a conversation last night, and a lot of us were saying, except for me, they're moving to Toronto. They're working in Toronto, so they have to commute to Toronto. Some people are commuting to Markham, all around Durham, and then they come back to Durham, and that's where they rest. Which for us is an interesting phenomenon because if you migrated here from, or you come here, immigrated here from another country, the Caribbean or Africa, um, Scarborough or Toronto was a place you went to first, and then you would launch out from there. So it's almost like a weird transition of moving out to the east. And for obvious reasons, it's a lot cheaper in the east to purchase housing, a lot more space and whatnot. So we're recognizing there's something happening and we're trying to provide that distinction that no, we're here. It's not a different, but a group of Black people here that are experiencing being Black different from Toronto. And it doesn't mean that because we're Black, the same things that apply in Toronto apply in Durham or apply, Markham. So we're trying to highlight that. So it's been very interesting there. So those conversations we're going to have on the panel.
That's awesome. That is very, very true. So I think that that's really interesting, and I'm excited to hear what comes of this. And it sounds like it's going to be such an exciting event. So like kudos. This is such an awesome thing to have happen. And I'm curious, outside of the health report that we've highlighted, and also this sort of monumental event, if we're being honest, I'm curious in what other ways Durham CHC impacts the local Black community through programs and services just on the daily, anyone who's coming in and using the services and the programs that Durham offers.
Yeah, so we're cooking. We're cooking, as they would say. The Black Health and Wellness team, we started in March of last year, and a lot has happened since then. The team's grown. We started off with just myself and spent a lot of time thinking about how we, as at DCHC, how we want to approach addressing the needs of Black people. And so one of the things that we built our service on was having a Black clinic, Black health and wellness clinic. Started off initially with, it's only for Black people because it's kind of obvious. And then we spent time with, again, the community, and we realized that people have Black experiences. And that's a whole other topic altogether. And I'm not going to even try to have that here. But with that experience, we learned that no, we have to include other people in the clinic that experience being Black. If that makes, let me give you an example. So, I've had cases where, we don't have racialized or race-based data, not a lot of it in the healthcare field. So we're trying to, get that information in, trying to understand that. And so we'll have people fill out forms, trying to sign in for our care. And then from doing that, you see them and you're like, this is a Black driven, a Black facing, affirming clinic. And they're like, yeah, okay, but you're not Black. Yeah, I know. Okay, why are you here? Well, this is my wife, so I'm lesbian, and we've experienced all these different clinics that we've been to for years, and it's just judgment after judgment. Nobody's paying attention to us. And I'm like, oh, that sounds like a lot of my other patients that are Black. Come on down, you're in. We have people who have disabilities that haven't been paid attention to. You're in. Come on down. So it's like, I'm not saying I have any research that supports the idea of Black experiences. And I know depending on who you talk, I might get into trouble for that. But the idea is DCHC in general, that's our mandate. We are here to serve everyone. And so I want to learn from doing what we're doing. So anyways, I'm getting off on a tangent here. But we have a clinic called Kliniki. Kliniki is Swahili for clinic. The full name is actually Kliniki Yetu, which is our clinic. And so we will be launching that on the 1st of March. though we've been seeing around 170 patients so far in that clinic. I'm the main provider right now. We will be building our team out to have other providers. So that's one of the things we're doing in the community. Our our health promoter, Solomon Lome, he's out and about in the community, and he's really the I would say the conduit between our medical services and our social determinants of health, trying to build that there. Cases like we have people coming in that are refugees, and he's finding creative ways to have their medical bills paid for because you come in and you're just discombobulated. You're not sure how things are set up in Canada, and he's connecting them with those services. And then we just hired our community health worker, Salome Odeni. She's been awesome. Her job now is to connect with the community, with our partners, seeing opportunities where we could bridge those gaps for services for the people in Black people in Durham. And so we're building, we're growing. As Alfred mentioned, we have some new funding that came through that DCHE has been the lead for. In the background, we have sickle cell disease that we're looking at. We're looking at how we do work from the four walls of the clinic to now. Do we have a mobile service? Do we have telehealth? So we're really experimenting with and trying to be very open about how we connect with the community. And yeah, the one thing I'll say, we do not have all the answers. One thing you'll hear Francis Garvey say all the time, almost every event, it doesn't have to be perfect. And I think for the longest while, as we approach and try to deal with Black health and work with people to address the needs there, we're trying to look for the perfect outcome. And I don't think that's something that we're going to get at this time. But I think what we need to do is add humility in the work we're doing. We listen to people. We have people tell us what they want to see happen. And while it doesn't fit within our Western prescriptive way of seeing things, how do we make sure everybody's safe and work with the community in that way?
Awesome. Thank you so much. The whole idea of like non-Black people joining, I found so interesting. And I forget if I have this set up so that I was on screen at any point during that, but I was laughing the whole time if no one could see that. I do think like people do experience prejudice and biases that you and I would definitely, or all three of us here would completely relate to from a racialized lens, and they might not be a racialized person, but everyone deserves care. And I think that's very much the whole CHC model, is that everyone deserves wraparound care and support.
Exactly.
It doesn't matter what you're going through and what you experience in life. So I think it's awesome that your CHC and Durham CHC is championing that and being that voice and the change that's needed there. And everything you said about it not being perfect, I do assume though that it could get better with funding. And so this is why my favorite question is always to ask what increased federal or provincial funding and investment would allow your community health center to achieve. And either of you can answer this from your respective perspectives of what would money allow you to do?
I don't think I want to answer that because I'm not sure if money is a solution, but I'll let Alfred answer that.
Yeah, I had a big smile as you posed that question, Hillary, because I think even my own thoughts as is natural with the individuals in the circles you run in, right? They've become informed and shaped a little bit by others. So I feel like at least a portion of my sentiments are being infused by Kirkisms here. So
Yeah, Kirkisms.
that does it's a new thing, Kirk. Yeah, well, so I do think one of the large challenges that we have as a sector, and to an extent with the exception of maybe acute hospital care, which I spent the majority of my like admin life in, is these like singular 1 to 2, maybe 3 year pictures of funding and investment. And there are behaviors that come as a result of that when, you're quote unquote gifted with this opportunity to actually execute on things that the community and patients and clients need and have needed for a long time. I think it sends, differing messages as to what the nature is of, long-term health and wellness, and even the complexity around social determinants when we say, okay, well, You did a great job in your 20-page submission. Here's funding for a year and a half. Um, the check arrives in February.
Hmm.
Oh, right. And the year, right, the accounting year ends in March, right? Um, so that's the one thing has to be said. And I think the audience of your podcast is largely CHC and community sector oriented. So I'm imagining like, the masses just shouting and yelling in agreement with that unfortunate reality.
You are preaching to a choir, yes.
Absolutely, I think that's the saying. I will say I think I think we've all been exposed to community work and volunteerism. Um, but I think part of what I've learned, and I've learned quite a bit, within the almost a year that I've had privilege in working with Kirk is how much power comes through our people and how much you can accomplish just through bringing that energy forward. So, I'll let him maybe expand on, that sentiment. I think it's something that we ourselves could do better, really harnessing uh, the the energy, the excitement of the community that we serve themselves, in advancing the work and trumpeting and echoing the cause. And I think we're seeing just a smidgen of that as we move into the March 1st event. And I'm really excited because I think that's going to be a part of what of how we grow this work for the future.
Yeah. So I'll give two stories real quick. So the first one is, so I used before I became a physician, I worked in the community. I operated a shelter downtown Toronto for homeless youth. And if anybody is on in your audience that have any experience with the shelter system, especially for youth, one, we don't have enough. It's we never have enough beds. But you're always on that space of, do we even need shelters for youth, that are they can't find housing or a home to stay in for whatever reason. But in that space, what I've learned is that, and I had probably one of the best executive directors, Suzette Clunis, amazing lady. We wait a lot of times for funding. We can't get things done unless we have funding. And so, as Alfred was saying, you have to write that application, build your case, and then you're crossing your fingers, hoping to get funded. And then we went through the same thing, but the question we always ask after, well, are we writing the grant to get the funds to do the work, or do we believe the work should be done regardless, but we want to have more resources? And that's how I've been brought up in my professional career, is always to think before you put a grant out, is this cause something that needs to happen regardless? Let's say you don't get are you still gonna push forward? So when we're in the shelter system, you do things for the young people we had. We experimented a lot of things in terms of how we communicate with the community. Volunteering was at top notch. I connected with all the colleges, every single college, private and community college out there, to give me students, bring them in. I could work with them, I could teach them, but they will now connect, extend our reach to the point where I had staff-wise around 25 staff members, but my volunteer space was around 150 volunteers in the community helping the young people that we're working with. Fast forward to when I was in the States, I worked at a small hospital. We took care of around, what was it, 100 and I think it was 120, 150,000 people. And sorry, geographical space wise. But one of the things that was amazed, like in terms of what that I was amazed by when I worked there, was the hospital was an integral part of the community. It wasn't just there to provide care. I've seen through COVID how in the States they're slashing left, right, and center what hospitals to close, which ones to boost up, and all that. This hospital was a mid-level hospital, which, if you know anything about hospitals, mid-level hospitals are always on the cusp of being, okay, do we keep them or let them go? Right? Especially in the States and rural communities. This hospital, the community held on every single day. The community, if funds were needed, the president, who also lived in the community for years, would come in and say, okay, we're going to do this or we're going to change this. And working there, I felt so, even though I was not from the area, I understood how important the hospital was for that community. People work there, they got their care there, the amount of generations that were born there. So when I move forward now into working with DCHC and working with the Black community, I think it's important not only for the Black community, but DCHC with my engagement with the organization to highlight how important it is to have volunteerism be a big part of the work you're doing and also have those conversations. Yeah, we're applying for this massive grant. It's going to be awesome when we get the funds, but what if we don't get the funds? Do we still move forward? And that's where Black Health and Wellness came from for GCHC. We sat down and we're like, regardless of funding, regardless of, we have to make the steps needed to prioritize the needs for the Black community in Durham. And yeah, we're getting funding, but you could always do with more. But I think sometimes we spend too much time looking at what the money will do versus what can the people do as it is right now. And the people includes your partners. And you'd be surprised, as Alfred was saying, this Black Health and Wellness Day event planning for me. I'm not by any means an event planner, but what I've loved the most was we've had 7 months, 7 to 8 months of planning. And if you know anything about the Black community, it's really hard for us to work together. There's trauma in the background sometimes that kind of drives how we communicate. And I'll tell you this, it's been probably the most enriching experience that I've had in my lifetime to date, just to see how well we worked. And we're talking about organizations like Lake Ridge, organizations like I mentioned before, Durham Children's Aid Society, DDSB, Durham District School Board, the police, everybody's coming in their own ways to support this event. So it's to me, that's the most important part about funding. If we have that conversation, that's why I couldn't answer it. I don't know how to answer the federal versus prevention. No, but I know if money could get things done, but we got to have that conversation. Okay, what if we don't have money? Alfred, didn't I have I think I had a workshop last year. I called it, what was it? More money, more problems.
That's right. That's right.
Yeah. So we had a group of CHCs. We did
The
a thought
millennials in the audience.
experiment. Yeah. And we said, okay, make the best CHC you could have. And they sat there, they drew it out and all that. And then we talked about all the problems attached with having all this money because, it's one thing to say, build the best CHC. And then you put a price tag. How much does it cost? And somebody was saying, oh, it's $5 million. Okay, why not 10 million? Well, because it's 5 million. Well, but why not? And the conversation just blew from there. So it was a really good experience. But that's my thought behind money.
I love that. I think that it's the first time this question's been answered this way, and I've been at this job for 3 years.
Yeah, but please make sure it's clear that we need money.
But yeah, like don't say
Clark, what'd you do?
However,
Yeah.
but I do think that it is really important. And we've done, as Catch, we've done certain projects as well that have, in a similar way, have highlighted the need for a systems navigator and different tools and resources at CHCs that after our funding and our project ended, they found a way to continue to do it because it is that important. And so I think that positioning is refreshing and it's a really great framework because as we're seeing, the money is going to come and it's also going to go, and different hands mean different things happen with the money. So it's important to decide what is your foundation, what is your base requirement to impact people the way that Durham CHC is, because sometimes there will be money and sometimes the government changes and it won't be there anymore. And then maybe it'll change again and it'll be back. We don't know what's happening.
But it
So I
should not
appreciate
matter.
that
It should not
framework.
matter. Yeah, exactly.
Exactly. So thank you both so much for this absolutely lovely conversation. I'm excited to see what happens on March 1st. I'm excited to see more of the report. I believe I only saw a draft version. So once I have that final version, or if it exists, I would love to link it and share it out and disseminate it with our community so everyone can see the amazing work going on with the Ontario and like sort of lower Toronto-ish and Durham region CHCs that were able to be a part of the report. But anyone who wants to attend the event on March 1st, because this will come out before that, or learn more about Durham CHC as a whole, either of you can answer where on the internet they would go to learn more.
Right. So they could literally check out Eventbrite. They could Google Black Health and Wellness Day. I tried it myself and literally we popped up, which is awesome. We're going to be you can just show up. We're going to be at the Ajax Convention Center. I think it's 550, can't remember the road there, but Type in Ajax Convention Center and go where it tells you to go, right? And be there between 10 and 11, absolute the best time to show up. But we're going to be there from as early as 9:30 and we'll go straight through till 4. And we'll be there waiting for you.
550 Beck Crescent is
There you
the
go.
convention center, but it is on Eventbrite, which I can put in the description. And then what is the Durham website for anyone who just wants to learn more about your projects, programs, everything that you're doing from a primary care and other work perspective?
It's durhamchc.ca.
Perfect. Awesome. That will be on the screen now so that people can check out all the amazing work that you're doing. But I hope that the event on March 1st goes so well. And congratulations for all this amazing work championing Black History Month and all people, all months, all the time, because that's what a CHC does. Alfred, Kirk, thank you both so much.
Thank you so much for having us.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.